Hi, this is Dr. Saxena, and we've been talking about some things, and which I felt it doesn't bother you, but excess will cause you a problem. And I have seen from my childhood. We used to label some person like who does it more. I'm talking about something called sweating. The sweating is a normal phenomenon, and it is not a disease. And excess sweating can be problematic. For that, you need to understand what exactly is this process called sweating. It's a perspiration is called sweating, and it's a watery fluid secreted by the sweat glands. Sweat glands are usually apocrine glands. Sweat glands are situated all over. You have got in the palms, you have got in the scalp, you have got in the all the skin. Usually, the skins which are some people get excess sweating over the face, over the scalp, over the hands, and all that. So there are things which we can always work it out. But for a general person to understand what is this called perspiration, perspiration is again it's a normal phenomena, and the normally by taking out through the sweat, this is basically skin is a excretory organ. So it is trying to excrete something out by the way of sweating out. I can always tell you it is a excellent thing. 5% of the ingested alcohol is excreted from the body via perspiration. Perspiration is a minor vehicle for excretion of some minerals. Perspiration, sometimes some vitamins get out of that. Excess water is the excretion of excess water is through perspiration. So what happens with perspiration? This we are nearing this summer now, and everyone is talking about how to keep yourself hydrated and all that. At the same time, this is the body's normal mechanism. Perspiration regulates the body's temperature and cools the body when the body temperature is too hot. The cold sweat associated with emotions occurs as a result of stimulation of sweat glands by the parasympathetic nervous system. People get cold sweats in a winter also. It is because of that parasympathetic thing. I have seen people, postmenopausal people, get into kind of sweats as well as palpitations because of that particular stuff. So here we are talking about even there are some things called pheromones, which are aldosterone, which are emitted from the males via perspiration. This pheromones is kind of it's one of the it is aldosterone is secreted through that, excreted through that particular thing. So we will just talk what are the things which induce perspiration, or what are the substances inducing perspiration. Usually spicy foods is one thing I'd like to be careful. The more spices you eat, the more you perspire, the more you sweat. Particularly capsicum is the chili is the major thing. And there are two other things which I would like to discuss. Is one is the malic acid, and one is the vitamin K. The substances, these herbs which induce perspiration, herbs there are list actually, and I think this is the term is given is at diaphoretics. You have got astragalus, you have got sarsaparilla, you have got fenugreek seeds, you have got ginger, you have got chilies. All these things induce the perspiration. Some people do get into excessive perspiration, which is called hyperhidrosis. Hyperhidrosis is excessive perspiration caused by excessive stimulation of sweat glands by the sympathetic nervous system. You get some, you are tensed up, you get some bad news, immediately start perspiring. You get some, you're faced up with the interview, you need to go walk into that. Your your sympathetic system is pounding, then you got sweating and all that. This is one thing which is called hyperhidrosis, and everyone knows about this. and it is usually, I believe, there are some people who sweats a lot. It is a deficiency of linoleic acid, fatty acid. It can be a deficiency of calcium deficiency also. You have a lot of antiperspirants which are developed commercially for the specific purpose of suppressing this excess thing acids. So there is a simple herb which is a sage which can help in that particular stuff, and which thing, there are a lot of things which causes hyperhidrosis. We need to get into the thing. We try to understand it can be from a simple infection, or it can be a symptom of a chronic lymphatic leukemia also. Usually hyperhidrosis occurs after a result of fever. People do get hyperhidrosis with hyperthyroidism, pneumonia, female menopause. So what this hyperhidrosis causes is excessive thirst, and this excessive perspiration can result in dehydration. You need to be careful about this particular stuff. And simple things first, we would like to rule out all the stuffs, and before that we would like to go ahead and work on this particular thing. But I can always tell you, this antiperspirants, try to be away from these things called antiperspiration. This antiperspirants, it is not required, number one, and it usually contains aluminum. Aluminum is the most common dangerous kind of stuff. It will give you some things in long term which can be as nasty as Alzheimer's also. You can get into that, but you need to be careful about this particular thing. So this is regarding something like sweating, and I believe sweating can be a good one also. Sometimes people having a excess kind of things is a kind of bad. So we need to understand what are the things we are trying to look as a doctor. When we normally patient doesn't come with sweating, they don't unless it is an emergency in ICU. People getting with MI, they get in, they were sweating. It's because this is because of that particular thing, but it's a very common symptom and which is rightly ignored, and can lead into something like water imbalance and all that. So be careful, try to look into all the stuffs, and again try controlling that, and stay away from disease. Take the dis out from that ease. That will help you. Thank you.